we're going to kind of get up and move here, and before we do that, we're going to start with a little bit of a self-assessment. So if I hurt my back or if I'm feeling pain, there's a couple of questions I want to ask myself to figure out if I can figure out how to deal with this or what I should do. So Shayla's going to come on in here, we're going to walk through a little bit, okay? So if you guys want to do this with us, you can. You're going to stand up. If you are in acute pain, if you hurt yourself a day or so ago, if you can't move, if tying your shoes is really difficult right now, please take this with a grain of salt for now. If you want to try, do what you can, but the goal of these is to move slow. So we're just going to see what it is we feel, where we feel. So, first thing I got to ask myself is, okay, I feel some back pain. What did I do? Do I remember what I did? Did something happen? Did I fall? Was there major trauma? Did I get in a car accident? Did I fall down the stairs, fall off a ladder, fall off a roof? If this just happened yesterday or this morning, these are some red flags that might lead me to go seek help somewhere else. Okay? Because really, really serious trauma can do some serious injury. But if I have back pain and I just woke up this way, or I bent over to pick up my sock, or I just started feeling a twinge, or I sneezed, there is an exceptionally low chance that there is serious tissue damage going on. Barring some really, really specific issues like serious osteoporosis or other very different concerns, it is extremely difficult to break a bone, dislocate something, or blow stuff apart without major trauma or impact. Okay? Now, I know I did say a car accident or major trauma or a fall. If I have back pain now and I had that 10 years ago, I had a car accident 10 years ago, it is exceptionally unlikely that I currently have a fracture or have something that is worrisome. Okay, so that's kind of our disclaimer, but again, it is very unlikely that I'm going to have that kind of serious issue. So, what happened? What did I do? The next thing is then I need to look at my red flags. And our red flags are reasons to go possibly to the emergency room or to seek help from our doctor. Okay, and what these are going to be are signs of something else going on. Am I having total paralysis? So not necessarily, it's hard to stand up or move because it hurts. More so when I walk, my foot is slapping the ground because I can't lift my toes. If you look at your foot and you can't lift up your foot, but you could do it yesterday, that's a problem, okay? If you're having progressive pins and needles or numbness, maybe I hurt my back 2 hours ago and now my foot is a little tingly, and then an hour later my whole foot is numb, and then an hour later I can't lift my toes, that's an issue, okay? Those are some things to consider looking into some other help. And lastly would be signs of some other serious issue going on. So maybe I have some back pain, it started yesterday, but I didn't do anything, and it's really severe, and it doesn't bug me when I move or do anything, it's just there, and maybe I've had a fever for 2 weeks, or I've just lost 30 pounds in a week and I didn't mean to, or I'm waking up super sweaty every single night. These are some concerns, maybe we need to go seek other help. But again, these are very, very, very rare things. So, we're going to talk about moving to feel what it is you feel. So, what did I do? How did this happen? Next question, where does it hurt? Can I touch it? Okay, is it something that when I poke on it, it's tender, or is it in deeper? Okay, is it one side or the other? Is it on my left side or my right side? Is it down low? Is it up high? Is it everywhere? Where do I feel this? Okay, this is a pretty important thing. Next piece then, where can I move or how can I move that makes it hurt? And we're not going to try to injure ourselves or do anything that drives you crazy, but can I move in a way that says, ooh, that actually makes it bother? And I know that sounds kind of weird because you don't want to hurt yourself, but what that is, that's a good thing. If we can bother it with a movement, it means it's a specific tissue involved. So Shay's going to come on over. Sorry I brought her over a bit earlier there. We're just going to go through these movements. The first one is just bending forward. And most back pain is going to struggle with bending forward. So she's just going to do a curl towards a toe touch. Good. And if you can't touch your toes, that's okay. If you know this is going to be painful, you don't have to go through it. If you feel the pain, you're going to stop at the spot you feel it. So you're not going to blow through it and keep going. You're just going to think about, what do I feel, where do I feel it? So she's going to do a couple of these. And after about 5 or 10 of them, she's going to ask herself, did that get better? As I did more, did it feel better? Did it get less tight? Did it get more tight? Did it get sharp? Did the sharpness go away? So I find a movement that bothers me, and I do it gently within tolerance and repeat it. As I repeat it, if it gets better, that's a really good thing. If it gets worse, it's a movement that we keep in mind, but we're probably going to try to avoid for a bit. The next thing is extending. She's going to do a back bend. So you'll see her hips travel forward, nothing crazy. She maybe gives a little bit of a push with her hand. And she's going to try this about 10 times. Is this feeling better as she does it? Is it feeling worse? Is this making pain worse? Is this taking pain away? And I can tell you, if you are having general achy low back because you've been working from a desk or sitting on your couch, there's a chance this will take your pain away. What she's going to do, she's not going to go too far. She's not blasting through the discomfort. She's just finding it and backing off. That's it. Okay? The next one then is going to be side to side. Pretty simple. And all she's going to do is, I'm a little teapot all the way down one leg. And then again. And same thing, 5 to 10 reps each side. What am I feeling? Where am I feeling it? Is it worse on one side? Is it totally different on one side? Does it hurt in every position? Is it all bothersome? What do I feel? So we're just collecting information to think about this a little bit, okay? If you find a specific position that is super painful, it's the worst, keep that one in mind, because that's a position we want to get to, we want to be able to get back, but oftentimes we're going to have to try the others, and as they get better, that one will get better, okay? And sometimes what you're going to feel, one specific position is really sharp and angry and just really painful, and so are the others. They're painful, but they're a different pain. Maybe they're more of a tight or a stiff or a sore, and one of them is a sharp stab. Sharp stab is the one we're going to back off of. Achy, sore, tight are the ones we're probably going to gently ease into. And I bet you as achy, sore, tight feels better and better, sharp stab will also decrease. So, we're going to go into some of these exercises now. Again, these are pretty simple. If you guys have done yoga, if you've worked out with a trainer, I'm sure you've seen some of them. The beauty of these is some of the minute details. And again, our activation or stabilization are always going to be our best bet. Okay? So, first thing we're going to do, she already did 2 of them. It was the back bend and the side glide. Okay? So let's say I've got one-sided back pain. It's my right side. It's right here all the time. When I get up, I'm going to try gently 10 of those back bends and see, okay, how does it feel? Then if it's on my right side, right here, she's going to do 10 side bends to the left. What she's, this way. So it's her right side, she's bending to the left, she's shifting to the right. What she's going to feel is a little tension right here. She's not going through it. She stops when she feels that tension and then backs off. So find it, back off. Find it, back off. Find it, back off. And honestly, if you have one-sided back pain, this is probably going to be a big relief. If it's super intense today, it might be a little aggravating, but I can bet you later on this will be a big one for you, okay? So I just find the pain, let it go. Find the pain, let it go. 10 to 20 times, it will decrease. So if you find these 2 helpful, and you have the ability to get on the floor, we're going to do so now. So what Shayla's going to do here is something we call the sloppy push-up. It's also called a prone press-up. If you're a yogi, it's called cobra pose. But she's not going to do this from a posing position. She's not going to hang out here. Remember, we talked about pumping a joint. So all she's going to do here is pump the joint into a little bit of extension. Hopefully you don't have any major wrist or shoulder issues. If you do, let us know. We can always come up with some different ideas for this. But probably the standing option would be your best. But you'll notice all she's doing is pushing up. As soon as she feels stiff, tense, or tight, that's as far as she goes. She comes back down. After 10 or 20 reps, all of a sudden that doesn't feel so stiff, tense, or tight. Or maybe she still feels tight, but she's going 10 times farther. So nothing crazy. This is called a repeated movement. Okay, so same as the standing back bend or the side glide. This is the sloppy push-up, and she's just doing it a little bit at a time, pumping that joint. If you find any of those three helpful or they feel good, I would encourage you then to retest your bending forward, bending back, and side to side after, and see if you notice a difference, because you're probably going to find out it feels a lot better. Okay? So the next one after she's done that is called a prayer stretch. This is pretty gentle. In yoga they call it the child's pose. This is our easy way to put a little bit of flexing into the lower back. So Shayla's just sitting right back onto her heels, gently letting her chest and her arms come down. Again, this is nothing crazy. We'll look at a seated position of this if you're at your office and you just need to get a bit of relief. These are not our fixes. These are going to be more our Advil, Tylenol type thing. They're going to give us some temporary improvement. Okay? And if she likes this, if it feels really good, she can take it side to side. So she's going to cross one arm over the other. She'll feel more of that over here. We're doing this very slow. She's breathing deep. She's repeating back and forth. Nothing crazy. Super simple. She's feeling tension through here and a little bit into the hips and legs. Possibly into the shoulders too. So we just covered our extension bending backwards and our side bending and bending forward. Really easy. I hope you guys are following along. Hopefully it's not too sore. We're going to do some rotation now. So we call this one the hip swivel. It's one of my favorites. If you're a yogi, you're probably going to recognize part of this as a spinal twist. It's going to come towards that a little bit. This is going to help open up some of those joints a bit. This can be pretty sore, so we're not pushing through pain. We're going to it, releasing. Going to it, releasing. So Shayla's going to lay on her back with her knees up and her feet together. All she's going to do is let her legs fall over to the side. When she does that, it's going to lift part of her pelvis and her back. Her shoulders stay down, so this is creating some rotating of her torso, and she feels some stretch right through here and possibly into the hip and glute area. And you'll notice she's just back and forth. She's not going to sleep that way. She's not going to hang out there for 20 minutes. I can tell you I've been guilty of that before, where it feels really good and you're in pain and you just hang out there. You may be in a bit more discomfort when you go to get up. Remember that tissue creep. We don't want to hold that stretch on those non-stretchy tissues. We just want to get them moving and rocking. From this, we got a bit of a different version. We call it a leg sweep. Okay, so she's going to flatten down one of her legs. She's going to straighten out the other leg. She's going to bring it over her body and all the way across. Some people call this the iron cross. Again, this is, if you're a yogi, this is getting closer to our spinal twist. Now this is a little tougher. She's using her hip flexors and core muscles to do this. This is more of an active movement instead of just letting the hips fall back and forth. And again, she feels that stretch up her side, up the back, and a bit into the glute area. Nothing too wild, nothing too crazy. She's going to repeat it maybe 10 times back and forth, and she can come back to it either side. And again, guys, we do have a handout we're going to email to you as soon as this is over. It's going to have a couple of these listed at the bottom. If you have any questions about them, again, ask us. We can send you a video clip or have a chat about it. The next one is we're going to look at a little bit of stretching or moving of some of the surrounding muscles. So if you sit a lot and you have low back pain, I bet you've probably said, my hips are tight. My hips are tight, my hips are tight. Now we're going to do just general easy hip stretching. I know some of you on here have some pretty awesome hip mobility programs. We know some people have some awesome hip mobility programs they can take you through. Today is just general easy ones. We're looking at getting out of acute sharp pain or doing something quickly to relieve some of our achy back. So Shayla's going to do some glute stretching. So our glute's going to cover pretty much all the back of the thigh and the lower back region. If we have a lot of tension there, we're probably going to have some stiffness in our lower back. If I'm lacking some of that stability in my lower back, I'm going to have a lot more tension through my hips to try to compensate for this. So she's going to cross one leg over the other knee, and she's just going to bring this guy up. Nothing crazy, nothing too wild. She's not going to hold this forever. She's just going to do it repeatedly, that's all. If you really love stretching and you want to hold this forever, please go ahead. Keep in mind, if we're adding stretch to our non-stretchy tissues long enough, we can create some irritation or soreness. She can change this up a little bit by bringing it across her body towards the opposite shoulder. That's going to change a little bit about where she feels it. Nothing too wild, but a bit of a change, and it may be really helpful for some of that kind of one-sided back pain that kind of goes into your buttock area, that kind of thing, okay? You say my hip, my hip, my hip, and you're not pointing to the front, this is probably going to help take that away temporarily. But I can also bet you, if you do some of our core activation without touching your hip, your tight hip will probably not feel so tight. So, next one, pretty simple. If I'm doing a lot of sitting, I'm pretty short through my hip flexors. Shay's going to hop up and show you this one. If you have knee problems or a ton of knee pain, please let us know. There's a ton of different options for this. So if kneeling isn't a good one for you, we can do lots of different ones. She's going to drop that knee down. She's going to tuck her tail under. So you'll see she kind of tips her bum back. And as soon as she does that, she probably feels a stretch right here through the front of her hip. Okay? So she hasn't even come forward yet and she's feeling this. What she's going to do is just move her body forward by lunging into the front foot and then back off. Super simple, right? Nothing crazy. And again, she's not hanging out there forever. She's just going there and releasing. Going there and releasing. Going there and releasing. 10 times, 20 times, as many times as you want. If this feels good, do it all day. If you're in acute pain and this gives you relief, and you can't do anything else, you haven't been able to get out of bed and you can do this and it feels good, do this until dinner time. I bet you you'll feel a little bit better after. She's not stretching here, she's not hanging out there forever, she's just going in and getting out. And the last piece of our release or our relief is if you happen to have a lacrosse ball, a tennis ball, or a hard rubber ball. So I'm just going to show you before Shayla hops down here. She turns around. Right down the center of your back, you're going to feel bone. We don't really want to be smashing ball into bone. It's not going to feel good. All you're going to do is come right off the side of that. You're going to feel lots of muscle tissue. So she's going to lay down on the ball. It can be a tennis ball. That's totally fine. Okay? And all you're going to do then is rotate onto it a little bit. You're going to find that spot, and then she's just going to move a little bit from there. So the ball's on the floor, she sits it in there from the side, kind of right above her pelvis, sort of right where your belt would be. You can feel it. If you poke in there with your thumb, you're probably going to say, yep, that's my sore muscle, that hurts. Okay? Once she's there, you'll notice she's doing that hip rocking again. So she's not smashing this ball and holding it that way. Okay? We don't want to create a bruise. We're not trying to beat your muscle into submission until it lets go. You're just trying to decrease a little bit of that spasm or tension. And I promise you, our activation exercises or stability exercises will have the same effect and will be longer lasting. However, sometimes it helps take away a little bit of the pain temporarily to do something like this. So super simple. She's going to pick a couple of spots, gently moving, gently rocking, letting the ball relax into her muscles. And then she can do the other side. But if you have one spot and you know where it is, remember when we did our assessment, you're thinking, where do I feel it? Where does it bug me? That's a good place to try that ball. Okay? So, we're going to move into our activation or our stabilization exercises now, okay guys? So the first one we're going to go with, again, if you're a yogi, I think they still call it cat-cow or mountain pose, that kind of thing. This is so simple. This cannot be a more important exercise. This is unbelievably important. Again, we talked about pumping those joints. So Shayla's going to go into all fours here. What she's going to do is push the ground away with her hands. So her upper back is going to come up towards the ceiling right here. Good. Now she's going to pretend she has a tail. And she's going to use her tail to determine how she moves. So she's going to stick out her tail. As she does that, her low back arches down towards the floor. So she's using these muscles to do this. She's going to pause. If you have sharp pain here, don't go through it. Just go to it. Then she's going to come back up. She's going to tuck her tail under. She's using her tummy and her core muscles for this. They're rounding that back up towards the sky. Super simple, nothing too crazy. Giving that guy a push. Okay, and again, this is easy. This is really easy. I'm just pumping my joints, decreasing inflammation, moving that fluid around, lubricating those joints, getting some blood into those muscles. So if you had a back injury 10 years ago, or if you're getting the I'm stiff and sore from sitting at my desk, this is your best friend. But we're going to take this one step further. Because if you're not in acute pain, we're going to make this a strength exercise. We're going to turn this into an endurance and stability exercise. So if you have a chair or a footrest or a stool, now's the time we're going to use it. So Shayla's going to bring this box out. What she's going to do is bring her feet a little closer to the box of the chair. She's got her hands on the chair as if the chair was the ground. So she's in the same position, that all fours position. And now the tension of her legs is fighting against the tension of her back. So she's going to press into the box, pushing her upper back up to the ceiling. Good. She's going to let her tummy come down towards the floor, sticking out her tail a little bit. Okay? She's going to pause, giving the back a bit of a squeeze. Her knees are slightly bent. And then she's going to relax and round the back up again. So the exact same movement, nothing crazy. And when we do this, again, we're always looking for a minimum of 10 times. 20 if it feels great. 100 if it feels amazing. And if you're in acute pain and you can't move, but you can do a bit of this, do this for hours. You can do it. If this is all you can do it for hours. You will wake up better tomorrow than you did today. So now we get into a bit of endurance. So she's going to let this come down a little bit again. She's going to slowly take one hand off and cross her chest, and then slowly bring the other hand off and cross her chest. So her black might be blending in a little bit there, but what she looks like is this. Okay, I'm not rounded up like this. She's in that position right there. Okay? You may recognize this a little bit if you've done some training before or you've seen a therapist before. We call that a hip hinge. And that hip hinge position is how we're going to pick things up. This is how I'm going to produce some load through my spine by using my hips and legs. So when she does this, she'll go back down again. She had to come out of it for a second because you will feel some fatigue. She's holding this position, breathing for a minimum of 10 seconds. Okay? If you can hold it longer, that's fine, but we're going to start with 10 seconds. So she's feeling fatigue all through here and the legs. When she's ready to be done, she puts one hand down, the other hand down, and then she relaxes her back. And we're going to repeat this until you feel that fatigue. Like, wow, my back muscles feel tired. Did I just cause them harm? No. Did I just pump them full of blood? Yes. Did I just move my joints? Yes. Did I just encourage stability of those joints by those muscles actively controlling it? Yes. Unbelievable exercise. If you're a desk jockey, if that's kind of your thing, or you've been sitting on the couch a lot, get up, put your hands on that couch or the arm of the couch. It looks like Lee was doing that a second ago. Give this guy a try, you're gonna feel better. The more you can do that in the day, the less you're gonna have hip tightness and back pain or hamstring tightness at the end of the day. So, before she gets too tired, we're gonna move on to our next one. This is one of our big spinal hygiene exercises. It's called the modified side plank. Again, you've probably seen it. My biggest thing here is if you have shoulder problems, please let us know. We'll see if we can find an alternative exercise for you. So what she's going to do, her knees are bent, her hips are up a little bit. She's going to drive her shoulder into the ground so it's nice and strong. She's going to lift her bum up and forward. So now her shoulder, her hip, and her knee are in a straight line. Pretty simple. It's not too much load. She's using just the knees so it's less leverage. She feels all the muscles under here. And she's going to hold this for, again, a minimum of 10 seconds. I would like to see 30 if you can, unless it's really, really sharp. Reason being, you are activating all of the musculature on that side of your spine right now. So super easy. But you're pumping blood into those muscles. You're activating the muscles of your hip. You're creating stability around your low back. That's it. Super easy. These are also probably the muscles that are getting achy and sore because you've been overstretching them by sitting too long. So put them through a bit of the opposite, and all of a sudden, they may feel tired, but they don't feel painful. Okay? And when that happens, you know you've done the exact right thing. You've specifically done one thing that targeted the part that was painful, and it took the pain away. So again, if you are a lifter, an athlete, heavy laborer, and you have back pain and it's there, but it doesn't stop you, looking at this and taking it to more difficult progressions might be the thing for you. So what she's going to do now is a full side plank. She's going to put her feet out straight. So same position, but there's more of her body off the ground, that's all. Same thing, she's going to hold for hopefully 30 seconds and repeat until there's fatigue. Fatigue shouldn't be creating more pain. It should just be creating some fatigue of the sore muscles. Pump them full of blood, they feel better. Okay? What we're going to do, obviously, this is a both-sided exercise. Pretty simple. We're going to move on to the dead bug. Okay? And this is going to work more on our hip flexors and the front of our core, and most importantly, the diaphragm. Okay? So this is a pretty simple one. So even if you're in a lot of low back pain, this is a really good one to start to get some of those core muscles doing their job again. So Shay's going to lay on her back. She's going to press her back into the floor. So she's not letting it arch off the floor. And she brings her legs up. As soon as those legs come up, you're going to notice that it wants to kind of tilt you into an arched position. Your core muscles lock you into that floor and they resist that movement. I mentioned the diaphragm. What Shay's going to try her best to do is fill her tummy with air. So when she breathes in, it's pushing up while her abdomen pushes down. So diaphragm pushes out, abs push in, that creates stability around her spine. Really easy. Once she feels comfortable here, she's going to start moving her legs a little bit. If you have pain in this, you're just going to move a teeny bit. If it's not too bad, you're going to gently tap your heel to the ground. You'll notice she's keeping her knees bent, so she's not moving too much. Again, if you want to make this exercise tough, or there's no pain, or you feel like this is too easy, you start to reach your leg out further. And it adds more leverage. I can promise you though, once you're there, it's going to be a little tougher to keep all those muscles focused, okay? We really want to make sure nothing through here, here, here is letting go, and we're not holding our breath. So when she has that leg all the way down, I want her to feel solid as a rock and be able to take a deep breath in and out all the way. Once you can do that, you know you're ready to take this further. Okay? So again, we're just getting muscles moving, encouraging stability of the lower back and pelvis region. Just have 2.5 more, okay? We're going to get into some questions. So next one, again, it's the last piece of our spinal hygiene exercises. It gets pretty easy. You've probably seen it before. It's called the bird dog. And I never realized why it was called that until we got a golden retriever and I saw him point at a squirrel. But what she's going to do is push her upper back up towards the ceiling a little bit, so she's strong through her hands. She's going to let her low back come down just a touch. She's going to reach her leg back. And this isn't about reaching her leg up high, this is about reaching her leg long. You'll notice she stays totally firm, there's no twisting, there's no leaning. What I'm going to do is pretend there's a hot bowl of soup on Shayla's back here. So there's a ball resting on her back, and as she moves, that ball goes nowhere. If you're in pain, I would encourage holding this, because it's probably not painful once you're up there. It's a pretty sturdy position, it's not too challenging. You're going to feel some fatigue through the hamstring, the glute, and you'll start to feel it in the lower back. That's a good thing. You might feel it in the shoulder, you might feel it across your tummy. These are the areas that are working the hardest. So again, a 10-second hold is a good minimum, working your way up to 30 to 60. We're going to repeat side to side. My goal is some degree of fatigue. Okay, I mean, again, I don't have to be taking this, 3 sets of 10 every single day. I don't brush my teeth until my teeth, hurt. I brush my teeth until I know they're clean. So if I'm doing my spinal hygiene, I just need to do it until I feel those muscles. If you're like, you know what, I want to take this further, I want to get stronger, you can do this much more. You can make this challenging. You can hold longer, you can move the leg, you can move an arm, you can encourage having to work a little harder. If you have a question for that, let us know. We'll give you an answer, a way to make it tougher. But just a little bit of this every day is going to be helpful. A little bit of a progression from this one, we call it the Superman. So it's just laying down. We want to make sure we got a pillow underneath us, because it's not always super comfortable to jam yourself into the floor. All Shayla's going to do is start by squeezing her bum, and she's going to lift her thighs just off the floor and her shoulders just off the floor. So she's not trying to get all the way up, she's trying to get long. She's going to feel pretty much every muscle from the back of her head to the back of her heel working with this one. So it's nothing too crazy. Again, we're just getting those muscles going. If I've been sitting all day, these muscles at the back of my low back are called my extensors or my erectors. And if I've been sitting all day, they are in the opposite position. They have been stretched. We're just giving them a bit of shortening, getting them a little bit of blood flow, putting ourselves in a position that we have not been in. Very simple, should not be super painful. If you are in acute pain, tread lightly. It's not going to kill you or harm you or blow anything up, but you might feel some discomfort. And again, she's going to be holding for up to 30 seconds, maybe longer, 10 seconds as a minimum. And the whole goal is repeat until you feel some fatigue. Our last one is called our glute bridge. Pretty simple. If I'm sitting, I'm not using my hips, my glute muscles. What she's going to do, feet on the floor, she's on her back. She's going to squeeze her core. She's going to squeeze her bum. And I know this sounds funny, but she's going to pretend she's trying to pick up a quarter. I know that's really weird, but what we want to do is focus on making the glutes do the work in this exercise. So Shayla has pushed all the way up. She doesn't have any back pain. That's fine. If you have a bit of discomfort, you can go half the range. Okay? Because you're going to get to a point where your glutes are no longer producing most of the work. It's your low back that's extending more to get you there. That's not a bad thing, but that may be sensitive for you if you've got a lot of pain right now. And again, we want to encourage lots of blood flow. We want to encourage activation of the muscles. So she's holding these for a period of time. So again, they're nothing crazy. They're nothing abnormal. They're nothing too difficult. And guess what? The simple things are the things that work. She's just pumping blood into those areas. That's why we had to go through some of the sciencey stuff. Because if I know why I'm doing that, that's all the difference. Okay? Put blood into tissues that have been overstretched. Warm them up, pump the joints, and move the joints.